Now, there's been an increase in COVID-19 infections since the Easter weekend. In the past 24 hours, 1,600 new cases have been recorded. This takes the total number of cases to over 1.5 million. 75 more people have died, pushing the death toll to just over 53,000. So is it too soon to start panicking about a third wave? Let's find out. We can speak to specialist in health, economics and finance at Wits School of Governance, Alex van den Heever. Alex, thanks for your time. We appreciate it. So we saw the numbers, just around the 400, 600 mark over the past couple of days. And then suddenly last night, we get 1,600. Is that cause for concern or not?
So it's still too early to tell because you will smooth it over a longer period, and there's the possibility that there is some sort of bundling of batching of data that is made public. We've also seen an uptick in the number of excess deaths that are indicated, which is often a kind of almost forward indicator of new infections because of delays in really reporting on the epidemic itself. So I'd say it's still too early to tell. It's unclear as to whether or not the excess death data for the most recent week that they've produced results is properly cleaned, and I think we will have to wait and see there. So I would say we're seeing some worrying signs. I think one has to be very, very careful at this point in time. But I don't think that we have enough information to be completely clear about what's going on.
Yeah. So how long do we actually need to assess the numbers before we know if we have a third wave approaching?
I think we'll probably have a good idea by the end of this week, by around about sort of Sunday, the next few days, to see whether these trends are continuing. Because when we do see an exponential rise, it tends to be pretty consistent. And the exponential nature of the increases means that the numbers become pretty hard to avoid. So we're right at the beginning of what could either be just a blip or a curve. And I think that we do need to see what's happened with the excess death information and get clearer information on that. If you have both of those indicators coming out showing an upward trend, then I would be quite concerned. The problem is that both sets of data do come out with a bit of a delay. And if the excess death uptick was true, then in fact the sort of wave began prior to the long weekend. But again, I haven't been able to absolutely confirm whether our latest statistics are accurate. And the most recent data often tends to have errors in it. So you kind of need to wait another week to see whether it is correct. But I think we're going to have to wait about another 3 to 4 days, and then we will probably see whether a consistent trend is coming through.
Alex, do you reckon enough people are actually getting tested, though? Because we look at the numbers now compared to the first wave. Is that in line with what we saw before?
What tends to happen is the testing is almost demand-based. We're not really doing community-based testing. So if people are symptomatic, then they will come forward for testing. And so you'll see a rise in tests as there's a rise in new infections. So they tend to move together. So the testing in itself isn't necessarily, the level of testing is not necessarily an indication of problems, because basically people come forward only when they're feeling ill. So if we had a different testing strategy, we could expect there to be more more infections that become clearer, but the testing strategy affects that.
Yeah. Alex, while I have you, I know you, of course, monitor the vaccine process as well. We've spoken about it previously. Let's talk about this decision to suspend vaccines, the Johnson & Johnson vaccines in particular, in South Africa because of those 6 people in the US who had blood clots. Do you reckon that was the right move?
Yeah, so it's very difficult to kind of second guess that kind of decision because it's done with an excess of caution. It's not necessarily an irregular decision. And I think that people want to retain confidence in the vaccines when they move forward with a strategy. And because of the specific nature of the blood clots, I think they want to also understand whether there's a way of avoiding the risk groups that might have a tendency to be affected by them. So on the one hand, they want to test whether or not there's causality. On the other hand, whether or not they could actually avoid risk for people because they know who will be most at risk of developing the blood clots. So I think there's good reason to sort of just hold back for a bit. In terms of the overall sort of cost-benefit analysis of doing it, it would make sense to continue with the rollout even if you had blood clots at this level. But I think they would rather avoid if they can.
All right, thank you so much for your time. We appreciate it. Specialist in health economics and finance at the Wits School of Governance, Alex van den Heever.